Hello, welcome to ANA community. What is the meaning of Vyadhi Janaka Hetu? What is the meaning of Karaka Hetu? And how to apply the principles mentioned in the context of Vyadhi Janaka Hetu or Karaka Hetu in current era or its relevance in the present day we are going to discuss in this particular video. Dear ANA community, put the thumbs up and press the bell icon so that the YouTube algorithms will be fetching you the right information on the time for the right purpose. The term Vyadhi Janaka Hetu is mentioned in Charaka Samhita, Nidana Sthana, first chapter in the context of Chakrapani commentary. This actually word comprises of this particular term comprises of three words, Vyadhi, Janaka and Hetu. So each are having the distinct meaning. When you think about the Vyadhi, the Chakrapani says, Vividam Dukkham Adadati iti Vyadhi. Whereas the Kayadasa says, Tasya Vyadhayah Vividam Dukkham Adadati iti Vyadhayah. In the sense, so that is the various kinds of the discomfort, maybe the somatic discomfort, such as headache or pain abdomen or itching or the loose motion, vomiting, etc. So these are the somatic discomfort as such, or the cut in the hand, etc. So these are the somatic complaints. Or a psychological discomfort, maybe in the form of the depression, or maybe in the form of the elated mood, or maybe in the form of the anger, or maybe in the form of the sadness, etc. So these are considered to be the psychological discomfort. So the term Vyadhi so refers to the various kinds of discomfort they are being observed in the patient. Of course, these discomforts actually, so these are the relative terms. In the sense, the person who is having the loose stools, some of the persons they are going to complain it toward the clinician. Some of them they will not complain. In the sense, in other words, some persons will be visiting the clinician after having the loose stool for once itself. Some of the other patients they are going to visit the doctor if they are passing the loose stool for more than 15 or 20 times. So in this way, the term Vyadhi, so they are actually the relative terms itself. For some people that may not be the Vyadhi itself, some people they are going to have the Vyadhi itself. When you think about the Janaka refers to causing or manifesting, and Hetu refers to Seti Kartavyatako Rogotpataka Hetur Nidanam. In the sense, Seti Kartavyatako Rogotpadaka Hetur Nidanam. So that is the Hetu refers to the Nidana. Roga Utpadaka Hetuhu. The one they are responsible for the manifestation of the Roga or disease or Vyadhi. How they are going to produce the different diseases? By Seti Kartavyatako. In the sense, so that is the various kinds of the uh, disturbed functioning that's happening inside the body. The person is going to consume the ruksha ahara, so that will be doing the various kinds of the abnormal functioning inside the body itself, such as ruksha unavriddhi in the mahasrotas, thereby responsible for the manifestation of the vata dominant disease. If the person is consuming snigdharasayukta ahara, then there may be the possibility of the disturbed functioning that can happen because of the abnormal increase of the snigdha guna, thereby kapha dominant disease are going to get. If the individual are going to consume the tikshna rasayukta ahara or tikshna guna yukta ahara, so that will be responsible for the increase of the tikshna guna in the body. Thereby we are going to observe the dominance of abnormal pitta in the body. So like that, Seti Kartavyata Ko, in the sense that will be doing the various kinds of the abnormal functioning in the body. That's how they are going to produce the manifestation of the diseases. That's why Hetu. So in turn, if you add all these three terms, Vyadhi Janaka Hetu are those which are responsible for, that is the causative factors or etiological factors which are responsible for the manifestation of the various kinds of the discomfort in the body. Either that may be somatic discomfort or that may be a psychological discomfort, or there may be a possibility of psychosomatic discomfort also. In that way, we are going to understand this. Whereas the description mentioned in the Chakrapani, that is Nidanam Karanam Iha Uchate Tatu Cha Eha Vyadhijanakam Vyadhibodhakam Cha Samanyena Uchate Tatra Vyadhijanakam Nidanam Hetuhu Vyadhibodhakam Cha Karanam Nidana Purva Rupa Upashaya Samprapti Rupam Tatra Heturupam Nidanam Janakam Cha Bhavati Vyadehe Bodhakam Cha Bhavati. In the sense, so that is the Chakrapani says there are two types of the Hetu, Vyadhi Janaka Hetu and Vyadhi Bodhaka Hetu. The term Vyadhi Janaka refers to the Nidana only, whereas the term Vyadhi Bodhaka refers to Nidana, Purvarupa, Rupa, Upashaya and Samprapti. In the sense, the term Vyadhi Janaka Hetu is included in the Vyadhi Bodhaka Hetu also. Whereas the Vyadhi Janaka Hetu will not include Purvarupa, Rupa, Upashaya and Samprapti. The same description mentioned in Gayada's commentary of Sushruta Nidana, so that is Karaka and Jnapaka Hetu. The term Karaka Hetu refers to the Vyadhi Janaka Hetu, whereas the term Jnapaka Hetu refers to the Vyadhi Bodhaka Hetu. Now let us further decode this particular Vyadhi Janaka Hetu. When you think about the Nidana sub-classification, as per the Madhukosha commentary, he says several sub-classifications are being mentioned. Sannikrishta, Viprakrishta, Vyabhichari and Pradhanika, one set of the classification. Another set of the classification, Asatmendriyartha Sanyoga, Prajnaparadha and Parinama, Dosha Hetu, Vyadhi Hetu, Ubhaya Hetu, Sadharana Hetu and Asadharana Hetu, Utpadaka Hetu and Vyanjaka Hetu, Bahya Hetu and Abhyantara Hetu. So the following are the further sub-classification of the Abhyantara Hetu itself. So that is Urdhvagati, Adhogati and Tiryagati, Vruddhi, Sthana and Kshaya, Chaya, Prakopa and Prashama, Oshtha, Shakha and Marmasti Sandhi, Prakrita and Vaikrita, Anubandhya and Anubandha, Sama and Nirama, Ashayapakarsha. Whenever if you are analyzing the Vyadhi Janaka Hetu, try to identify which particular category. So these Vyadhi Janaka Hetu are comprising among these categories. Whether they are Asatmendriyartha Sanyoga or Pratnyaparadha or Parinama, or whether they are Utpadaka Hetu or Vyanjaka Hetu, or whether they are Sadharana Hetu or Asadharana Hetu. In terms of the physical examination, whether these Hetu are in the Urdhvagati, Adhogati or Tiryagati, or whether they are in the Koshtha or Shakha or Marmasti Sandhi, or whether they are Sama or Nirama, or whether they are Prakrita or Vaikrita, in that way we have to make the analysis as such. Whenever if you think about this, by looking into the examples, we can learn the information even much deeper. For this particular reason, we are going to learn this particular Vyadhi Janaka Hetu with the following examples. Whenever, if you think about the person who is going to take the cold water and he is keeping it on the palm for a few minutes, so we are going to observe the certain changes in the skin itself. This is what we are going to observe, the skin changes, that is the shrinking of the skin that is going to take place. So here, when you think about the other parts of the body, we are not going to observe such kind of the shrinking. So that is only observed on the palmar area. So that is clearly indicative of the impact of Shita Guna on the Twak region, or what we can say the that is the palmar region as such. When you think about the same aspect, Shitala impact all over the body. So that means same kind of the shrinking may take place. Here there may be the possibility of the vasoconstriction. So the whole particular body, whole body, there will be the peripheral vasoconstriction that is going to take place. Of course, here also the impact is on the twak, but earlier example, it is only on the palmar aspect of the skin, whereas here there may be the impact will be generalized. Whereas the impact of the Shitala Jalapana, so that means if the person is going to drink the cold water, there may be the same kind of the effect that may be observed in the mouth, or that may be observed in the esophagus, or that may be observed in the stomach. But when you think about the overall impact, longer impact that will be observed in the stomach for longer time. So that means that will be responsible for the reduced secretions that are going to take place in the stomach region. Whereas if the same thing that is being present on the mouth, so that will be responsible for the reduced salivary secretions. In that way, the person will be having the thirst on consumption of cold water. Suppose if this particular cold water is entering into the respiratory passage, maybe in the lower respiratory passage, that may be responsible for the cough, etc. But there will be reduction of the secretions, the respiratory tract, that may happen. Whereas if that is happening into the upper respiratory passage, there may be a possibility of the shrinkage of the skin or shrinkage of the cells of the upper respiratory passages. In that way, when you think about the Shitala impact on Bahya Srotas are 9 Bahya Srotas in case of the males and 12 Bahya Srotas in case of the females. So the impact of Shita Guna or cold quality, so that will be having an impact on all these Bahya Srotas separately. For example, if the person is inhaling cold air, so that will be responsible for the reduced nasal secretions. If that is responsible for the exposure to ice, so that is responsible for the lacrimal secretions are going to get reduced. In that way, the impact of cold as such on the Bahya Srotas, that will be different. We are going to observe the Lakshana related to the exposure of these air Shitata on the Bahya Srotas. Whereas if you think about the Shitala Sevan, as we have discussed, earlier it was a simple cold water. Now we are going to observe the carbonated drinks. So in that particular situation, there may be the possibility of the excessive belching that is going to take place when the person is going to consume this particular type of the carbonated drinks. Thereby the person may be having the excessive belching, or what we can say the bloating sensation of the abdomen that is going to take place. In that way, we are going to observe this. Now, how to understand the Vyadhi Janaka Hetu as such? The first and foremost step we are going to see, first of all, observe the presenting complaint told by the patient, and that particular lakshana or presenting complaints that should be recorded in the chronological order. Chronological order in the sense, so the symptoms, if the persons are having 3 presenting complaints, which particular symptom has occurred first, which is the second presenting complaint, and which is the third presenting complaint. For example, if the person is having the sneezing for 3 days and cough since 2 days and running nose since 1 day, then that has to be recorded in the chronological order of the sneezing, then cough and running nose in the same present chronological order that has to be recorded. Plus, you have to document the other characteristic features or descriptions of the presenting complaint. For example, if the person is having the sneezing, when it was started, whether it is sudden or gradual, and what is the duration of that particular presenting complaint, then what is the severity of the presenting complaint, severity in the sense whether the person is able to do his routine activities or not, that has to be recorded, and course of the symptom, whether the person is having the uh, course in the sense the in terms of the beginning of the presenting complaint and the present day, if it is worsening in the sense initially it was mild, now it is severe, it is indicative of the course of the symptom is worsening. If the person is having the presenting complaint at the beginning it was severe, now it is becoming less and less severe, that is considered to be the course of the symptom is improving. Whereas if the person is having the presenting complaint severe in the initial stage, now also it is severe in the initial stage, in that particular situation the course of the symptom will be persisting. In this way, and the aggravating and relieving factors related to the presenting complaint, that has to be documented properly. And after that, try to identify the bahya srotas and abhyantar srotas afflicted in an individual. So try to identify the lakshana related to bahya srotas or lakshana related to abhyantara srotas. If the person is having the excessive, what do you say, that the bleeding per rectum, so here probably the bahya srotas afflicted could be the anus itself. And if the woman is having the pain in the uh, external genitalia, then we are going to suspect the exposure of this bahya srotas in that particular situation. It is could be the upastha as such. In that way, try to identify the bahya srotas afflicted as well as abhyantara srotas afflicted, that has to be known. For example, if the person is having the अतिसृष्टम अतिबद्धम कुपितम अल्पाल्पम भीष्णम वा सशब्दश्लोम उच्छ्वसंतम दृष्ट्वा, any kind of the breathing discomfort as such, that is indicative of the person is suffering from the pranavaha srotas dysfunction. In that way, we have to identify the lakshana related to bahya srotas and abhyantara srotas. After that, we have to map the presenting complaints and timeline of exposure of the nidana to the individual. That has to be matched as well as mapped. Then identifying the exact Vyadhi Janaka Hetu, then we have to reverse engineer the process by advising the right advice or right medicine, so that the patient is going to get the restoration of the health at the earliest time period. For example, if the person is doing the consumption of the cold water and he is having the bloating sensation in the abdominal region, etc., first of all, suggest don't drink the cold water as such, definitely, so that will be responsible for the restoration of health. To sum up, the term Vyadhi Janaka Hetu refers to 3 words as such, which means the causes responsible for the manifestation of the disease as such. How to identify this? That is, first of all, you have to see the lakshana observed in an individual, maybe perceived by the patient or maybe observed by the clinician. That is, the lakshana, that is both signs and symptoms observed in the patient, that has to be recorded. and we have to do the retrospective analysis of these Lakshana in terms of the Nidana that has to be done. Then we have to try to identify the Nidana from various angles and try to map these Nidana in terms of the Lakshana from various perspectives. That's all for today. Dear ANA community, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners. Dear community, put a thumbs up and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget, press the bell icon and so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.